Like many viral diseases, COVID-19 is a viral disease. And the best way to manage and to get out of the current pandemic and to avoid future pandemics or outbreaks of COVID-19, a vaccine is a perfect interrupter of transmission. And this means that the world has put a lot of hope in the discovery and production and provision or access of a COVID-19 vaccine. This is now a reality because we've seen a lot of companies and organizations and WHO increasingly involved in the development of this vaccine. But we must remember that when this vaccine is finally available, it will not be available to everyone overnight. There will be those groups that take priority. Groups like frontline health workers will take priority. Groups like the elderly who are at the highest risk of moderate or severe disease will take priority. And finally, people who live with comorbidities like hypertension and diabetes will take priority. And therefore, when the vaccine comes, one of the most important things to address is first, equitable access, that it will not depend on how rich you are to afford the vaccine, but it will be available to you because you are a human being and health is a human right. It will then also depend on our structures of delivery of this vaccine. That remember that most of our vaccine delivery mechanisms are based on under 5 children. But when we come to giving the COVID vaccine, it is likely that we'll need to get it accessible to the elderly, to people who are not in the current vaccine delivery chain. So we will need to adapt our vaccine delivery chains. And finally, we will require very active community participation so that we can overcome social and cultural barriers to acceptance to vaccines, which have arisen, especially more recently with social media, and have arisen because of fears of safety. We will need to engage communities more. And for us at Amref Health Africa, that's what we focus a lot on, engaging communities to ensure there is ownership and active participation.